First of all, what you heard from the governor earlier, I want to emphasize here in the city, obviously, this is this new reality of community spread. So the fact is, even compared to a few days ago, we have a very different reality. When we began the week, our focus was on people who had traveled to affected countries overseas and those who had come in contact with people who traveled to those countries. What's happened in just the last few days is the initiation of community spread, meaning that these cases now are coming from within our communities in an untraceable fashion. At this point, still 5 confirmed cases of coronavirus, 5 individuals in New York City. What we have now that we didn't have as well is our own information. So when we started dealing with this crisis, we were dependent on information from the World Health Organization and the Centers for Disease Control and the broader medical literature. Now, over these last days, we've started to get direct information from our own disease detectives, and they have every day more and more information to work from. And we also are working, of course, very closely with the state health department, and the cluster in Westchester is crucially providing us a lot of information. There's just more places where more New Yorkers might come in contact with someone because the disease has been spreading out in the community. Now, I remind you, the vast majority of people, they experience very mild symptoms and have no lasting impact from this disease. There are people who may have it, don't even realize they have it. We've certainly seen that in some of the cases already. How it transmits from people to people. We've said from the beginning, it is not like the measles, and I've asked our health professionals to be really clear and specific about this. Everything we know about this kind of disease, because it is part of a family of diseases, is you're never going to have a situation where it becomes a airborne disease, meaning it hangs in the air like measles does, like some other diseases do, and can be contracted hours later after its presence in a room, for example. That is not coronavirus. What it is something that transmits through bodily fluids, but not all bodily fluids. So again, forgive the bluntness. A sneeze, a cough, if you spit, and remember, sometimes people spit inadvertently just talking energetically. That's how it can transmit. But not just that, it actually has to get into your body, which means basically your mouth, your nose, your eyes. Hands can also be the path. If something's on your hand, and all of us have, we're touching our mouth, we're touching our nose, we're touching our eyes. People do it all the time, they don't even realize they're doing it. That's how it gets into you. It cannot just be any place else on your body or any place else in the air. It has to get directly into you. So the point being, you kind of need a direct hit because it doesn't just hang in the air. It's also important to know, I'm sure people will have common sense questions. What if someone sneezed on a countertop? The disease doesn't last long, literally minutes, and it's gone. I asked earlier, what if someone sneezed into someone's drinking water? It doesn't transmit through anything you ingest. What if someone sneezed on your soup? It does not transmit through something you ingest. It has to come in mouth, nose, eyes, through directly breathing it in, directly breathing in someone's sneeze or cough or spit, or it gets on your hand there to your body, but really soon thereafter, because it doesn't stay alive very long in the open air. As we start to give some new guidance, and again, this is not yet invoking emergency powers, and I hope we don't get to that point. This is guidance right now. We'll be very explicit day after day with any changes, and if we ever get to the point of needing to use emergency powers. So I'm going to separate the guidance into 2 categories. Folks who are well and folks who have symptoms. Again, the symptoms are the symptoms you would normally associate with a common cold or flu. If you're well and you don't have any symptoms, it's just go about the basic precautions. Wash your hands, use alcohol-based hand sanitizer. Try not to be touching all the parts of your face that allow in the disease. Avoid handshakes. So that's the update. My colleagues are with me, Deputy Mayor Raul Perea Hensi, Deputy Mayor Laura Anglin, Dr. Oxiris Barbeau, our Health Commissioner, Dr. Dimitri Daskalakis, our Deputy Health Commissioner, Chancellor Richard Carranza, our Emergency Management Commissioner, Deanne Criswell, and we are ready for questions.
Thank you. I actually have two, if you don't mind. The first would be probably for Dr. Barbeau, actually. And I'm wondering, there's obviously, community spread is here. A lot of people are concerned about kind of how widespread this might be. And I guess I'm wondering if you have a sense for how widespread the asymptomatic group might be. Like, if you were to swab this room, would you expect to see it? Would you expect to see flu if you were to swab this whole room? Like, I mean, can you put this in context?
I think right now, as the mayor has said, we are pivoting into what we're seeing with regards to person spread in the community. And so what that means is that New Yorkers are probably more likely.
Just run that by me again?
I mean, can you put this in context?
I think right now, as the mayor has said, we are pivoting into what we're seeing with regards to person spread in the community. And so what that means is that New Yorkers are probably more likely to contract or less likely to have contracted coronavirus from someone that had a travel nexus than from someone who had contact with an individual who had the disease. And so we're not at this point looking for asymptomatic excuse me, they've traveled. We want them to reach out to the doctors. Even if they haven't traveled, we want them to have a lower threshold.
So much for not touching your face or trying to cough into your elbow, eh?